So in this section, I'm going to talk to you about some of the potential challenges that you may face on your journey and how to quickly overcome them, but ideally prevent them. The first things first, if you're having anything that's difficult, get help. We want to hear from you. Call our infant feeding team, speak to your midwife or your health visitor, get the help and support. Sometimes really timely help can make the world of difference. Now, during the course, we've talked about the importance of positioning your baby and attaching them, so how they take your breast in their mouth, in a really effective way. This will help prevent problems such as sore nipples, and it may even help reduce the risk of something called engorgement, where your breast is very, very full of milk, or mastitis, which is where one of the tubes that delivers milk from the back to the nipple becomes inflamed or blocked. So by being able to get the right positioning and the right attachment, you can put yourself at a nice low risk of having any of these problems, such as sore nipples, engorgement, or mastitis. Also, this can really help then tailor your milk supply to be in the right amount for your baby. However, if you do notice that your breast is feeling very, very engorged, this is usually not just milk. Although it feels like it's full of milk and it almost is like ready to burst, it's actually a lot of inflammation in the area as well. What happens is the blood rushes to the area because it thinks, oh my goodness, something is going on here. We need to go here and check it out. And what happens is the breast can feel very, very full to the point where the skin actually feels quite tight. Your breast may feel hot to touch, and they might just feel generally really, really hard. Sometimes this can make attaching to the breast really, really tricky because your baby goes to take a big wide mouth, and because it's so full, your baby then slips to the nipple as opposed to nice, deep, rhythmical attachment this way. And one of the midwives I spoke to recently described it as a baby trying to attach onto a wet football. They go on and then they slip. Then what we have is nipple feeding, and this is not going to help that problem with the fullness and inflammation. So what can we do to help if you're feeling engorged? What I would recommend is start off with some gentle massage. Some gentle massage will help to really get things moving in the area. You can use your hand, you can use your knuckles, and just work for a few minutes around the breast just to get everything moving. What you can then do is also use something that's warm. Something not hot but warm will be really quite soothing and help a lot of those tubes that are delivering the milk to relax and open. This can be really, really nice before you start to get the milk to flow. Then what you're going to do is use your hand expressing technique. Hand expressing is a really, really great tool to keep in your toolbox if you find that you are engorged, because you may feel too full to feed. Your baby can't attach on, so therefore we need to soften the breast first. So just as we talked about in that hand expressing section, you're going to make a C shape, 2 to 3 centimeters back from the base of the nipple. And what you're going to do is compress, hold, and then release. And you're going to stay on the same area. If you're quite full, it may take a while to come because of the fullness inside. Just keep going on that same area. And notice how I'm not sliding my fingers towards the nipple. This won't help the milk to flow, and it will just cause irritation to the skin. So keep your fingers in the same place, 2 to 3 centimeters back from the base of the nipple, compress, hold, and release. And then after a while, you should start to notice that that milk starts to flow. Now, if you're planning to attach your baby to the breast for a feed, you can do this for a few minutes just to soften the breast. You may want to work on one area and then rotate to another area, and this just helps soften that part at the front so that your baby can take a nice deep attachment for a feed. Your baby is a great way of helping that milk to come through, and you will feel so much better after it once that milk has been released. And then after you've finished, you're going to use a cold compress, something that's cool and soothing. That can be really, really nice and make everything just feel a little bit more soothed. Now, sometimes we can get something called mastitis. Mastitis is inflammation in the breast. It doesn't always mean that there's an infection, But what it does mean is that there is something in the breast that needs to be looked at. Now, if you have inflammation, you usually notice it by a lump in the breast that's painful. You may feel and think, gosh, that's really, really quite uncomfortable, quite tender, or even really quite painful. Depending on your skin tone, if you've got a lighter skin tone, you might notice that the skin has gone a bit red. You may notice that there's just a change in the colour of your skin. And actually, for the majority of people, they might feel that it's hot to touch when they put their fingers on the area that feels painful. It might feel warm or hot. It usually occurs in one breast. And what you can do if that happens is encourage the milk that's in that tube to flow through. So what you can usually feel with mastitis is quite down, quite miserable, in pain, and you don't want to breastfeed. However, a quick way to really relieve that feeling is to feed, because what your baby's doing is getting the milk to flush through and relieve that inflammation or blockage. So what you can do is very similar to engorgement. You're going to do a little bit of massage if you feel able to, but if it feels too painful, then don't. You can use a little bit of warmth as long as you're not feeling too hot in the area, just to get things to relax and open. Then what you can do is attach your baby to your breast in a position where the baby's chin or their nose is in line with the area that feels uncomfortable. So let's say, for example, we have redness or painful lump here. I might go for the cross cradle hold in this position so that the baby's chin is working on that area that's blocked. Usually a blockage is on the upper outer quadrant of the breast, so actually quite a difficult place to clear. So you may want to line your baby's nose up with that area so that they work really well on that specific area. If you are too sore to feed, or you don't have the ability to breastfeed and you have a blockage, then what I would recommend is hand expressing. Hand expressing is a great way to target a specific area that's inflamed. So let's say, for example, this area is blocked. I'm going to work with my thumb and finger on that specific area, compress, hold and release. And what I can do is really aid movement in that very particular area. So with any challenges, the first thing I would do is suggest that you get timely support. Speak to your midwife or your health visitor, speak to your local infant feeding team or your breastfeeding support group, and tell them the challenges that you're having so that you can get the right support at the right time. This can make a really big difference in your breastfeeding journey.